The following program is a PBS Wisconsin original production.
Contention over the state budget continues as federal budget cuts hit home, while Middle East conflict draws sharp political contrasts. I'm Frederica Freiberg. Tonight on Here and Now, work on the next two-year state budget is back on as of today. We get an update from the Capitol. Also, where state and federal funding leaves two tribal programs involving health care and healthy food. And members of the medical community take a stand against changing vaccine recommendations at the federal level. It's Here and Now for June 27.
Funding for Here and Now is provided by the Focus Fund for Journalism and Friends of PBS Wisconsin.
Getting to the point of voting on a state budget turns out to be a difficult affair. The legislature's Joint Finance Committee was to go into session this morning, but has now pushed that off to 8 p.m. Wisconsin Public Radio Capitol reporter Anya Van Wountendonk joins us now from the Capitol with what's happening. Hi, Anya. Thanks for being here.
Hey, thanks for having me.
So what is happening?
Not very much. As you say, they were meant to go into session earlier this morning, and we have kind of waited around and heard as they have moved that start date quite a bit, that start time, I should say. And so what that tells me is that they are meeting in closed caucus. So things are certainly happening. They are just not happening in a way that we can see it. So we're waiting to see kind of what agreements they bring to the table.
Could they actually cancel tonight's session?
I suppose that's possible. You know, I think everyone's kind of running around a little bit trying to figure out exactly what's going on. A lot of texting of sources and other journalists and, you know, people that we know inside of lawmakers' offices. And I think the answer is no one really knows what's going on. But I spoke with one reporter who's been covering the budget for a lot longer than I have. And he said, essentially, you know, if you can dream up a scenario, it is possible. And so really, it's possible anything could happen tonight. It could go very late or things could get kind of shifted around.
Does this have to do with holdouts, Republican members of the Senate as holdouts?
Yeah, you know, again, we don't know exactly what sort of the push and pull is, but we have seen a lot of different scenarios kind of unfolding over the last couple of weeks. So first we saw legislative Republicans and Governor Tony Evers, talks between them kind of break down. Then they returned to the table. Then discussions between Senate Republicans and Assembly Republicans kind of came to a standstill. There were some barbs being traded on social media among Republicans over the weekend. And so all of that is kind of within this soup. We know that Governor Tony Evers has certain things that he will not sign a budget without. Republicans have said, you know, they will not give up their access to meaningful tax cuts. And so all of this is kind of swirling around. And I think as we get close to that fiscal year deadline, we're really starting to see things play out.
But meanwhile, they have some very big ticket items to decide on tonight and potentially through the weekend.
Yeah, that's right. They have both a long list of things in general. There's, I think, 50 items on the agenda for this meeting that has been noticed. And then, as you mentioned, some of them are really significant. Notable among those is childcare and the University of Wisconsin system. Those are notable in part because they are Governor Evers' big priorities. He has said he will not sign a budget that doesn't have meaningful investment in either of those. And so what that ends up being is a little bit of leverage for Republicans to kind of get him to the table on those tax cuts. But that also means that, you know, that there is as we mentioned in the breakdown between Senate Republicans and Assembly Republicans, a lot of push-pull around the amount of spending that the Democratic governor would want.
How does the slimmer Republican majority inform how this budget session has gone?
Yeah, so that also really speaks to, again, some of those chamber disputes that are going on. So essentially, there are enough Republican votes in the Assembly. And ordinarily, how this could work is that Republicans just vote for their Republican budget, and then the governor could go through and kind of use his partial veto pen, the Democratic governor. But in this case, in the Senate especially, it's an 18-15 majority, so a much slimmer majority. So if Republicans lose 2 votes, they don't have a majority there. And it's actually looking like they have lost 2 votes. There are 2 outspoken Republican senators who have said they just can't support the amount of spending that their Republican colleagues are proposing in the Joint Finance Committee. And so because of those slimmer majorities, that means either Republicans sort of need to get their folks in line or give them concessions, or they need to bring Democrats to the plate. And the way to bring Democrats to the plate is to kind of offer more palatable options to Democrats. And so again, we don't exactly know all that's going on between closed doors, but that's a huge part of the dynamic that's at play.
With really about less than a minute left, how does a ruling out of the state Supreme Court around Evers' vetoes play into this budget process?
Yeah, I think that's been a big part of the conversation because there's been a real breakdown of trust again between Democrats and Republicans in terms of how the governor has used his veto pen in the past. And so what that did was kind of give a little bit more clarity to the use of his partial veto pen. And so at the end of all of this process, we will at some point get a budget to the governor's desk. And now there's just some clarity on how he can and can't use that.
And do we expect that budget to get to his desk next week?
You know, it takes a while to write a budget. So even just that labor of that will take a little bit of time. So I am not terribly optimistic in that sense, but I'm not in the prediction making business.
All right. Well, we really appreciate you joining us. Anya Van Wagendonk from Wisconsin Public Radio. Thanks.
Thank you.
Directly following U.S. military strikes in Iran this week, the Department of Homeland Security issued a heightened threat environment bulletin warning of low-level cyber attacks by hackers affiliated with the Iranian government. The military cannot comment on force protection measures for U.S. troops in the region, but the Wisconsin National Guard does confirm troops from this state are deployed in the Mideast. In response to the strikes against Iranian nuclear program sites, Wisconsin U.S. senators weighed in. Democrat Tammy Baldwin saying, quote, "Diplomacy, not war, is the answer here. I stand with the people of Wisconsin who do not want to get into another war in the Middle East and put service members at risk." Baldwin also introduced a bill to prohibit federal funds going to military force in or against Iran without congressional authorization. For his part, Republican Senator Ron Johnson said, quote, "The president has been very clear. We could not allow Iran to become a nuclear power. I support President Trump's action in this case." On childhood vaccinations, parents may be wondering what's happening after every member of the Advisory Committee on Immunization Practices was fired by DHHS Secretary Robert F. Kennedy, Jr. The new committee, chosen by Kennedy, who is a vaccine skeptic, met this week and announced a review of immunization schedules and had some other changes. The Advisory Committee makes recommendations to the CDC on which immunization should be given and whether they are covered by insurance. Amid this upset to established vaccine guidance, a new project has taken shape at the University of Minnesota Center for Infectious Disease Research and Policy. It's called the Vaccine Integrity Project. Dr. Michael Osterholm is director of the center. He joins us now, and thanks very much for being here.
Thank you for having me.
So, were there changes made this week regarding immunizations that raised alarm bells for physicians and others?
Well, in fact, there were several things that happened at this two-day meeting. One is that we were able to count over 50 different instances where mis or disinformation were shared, things that just simply weren't true. And so that leaves people often confused as to, wait a minute now, what is the truth about this? In addition to that, they took certain actions. And for example, they voted on removing thimerosal from influenza vaccine. Well, let me just back up. Thimerosal is a type of preservative. It's ethyl mercury, not methyl mercury, which is the methyl is the dangerous type, ethyl is not. And what it is, it's used in multi-dose vials so that as a vial might be used over a day to a day and a half, contamination doesn't grow in it after having inserted the first needle into it. When in fact you look at overall use of thimerosal, less than 6% of all influenza vaccine doses have that. And as I pointed out, over the last 30 years, there's been ample evidence showing there is no safety issue with thimerosal. But this has been a very favorite target of the secretary over the years. He's actually written about it. And so they voted to take thimerosal out of the last remaining doses of influenza vaccine, leaving people with the sense that somehow they improved the safety of the vaccine. They did not. They did nothing. But this will be heralded again as an example of the administration basically protecting you as a citizen, when in fact there's no truth to that at all. So this is the challenge we have right now, is just about mis and disinformation and really making changes with vaccines that actually improve our health versus do not.
Is there reason for people to be skeptical of vaccines?
Absolutely not. Vaccines today are the safest they've ever been. If you look at the number of vaccine doses we have, yes, there are more of them, but because we've improved vaccines over the years, the actual amount of what we call antigens you get when you get vaccinated is much lower now than it was in the 1970s. So even people who have alleged that somehow kids are getting vaccinated a lot more today, and therefore there could be problems with that, it's actually not true. It's actually today we're at some of the lowest numbers of antigens being used in all the collective vaccines, and at the same time providing this incredible protection against these oftentimes life-threatening infections.
What does your Vaccine Integrity Project set out to do?
Well, first of all, we want to make certain that there is a source of information that's reliable, that's scientifically sound, and that people can count on. Right now, you can't count on the CDC data or information to be factually correct. There are many very talented, dedicated public health workers at CDC who do an incredible job, but they're not allowed to be part of this process. And in that regard, that's a huge challenge, because it means that others who have much less experience are going to be making the kinds of presentations that then the ACIP will vote on. At this point, all I can say is that when you look at the overall body of science and vaccinations today, it's never been a time where you've had more vaccines protect more lives against serious illness, hospitalizations, and deaths versus the very minuscule risk of an adverse event from a vaccine. And so what we're here to do is to provide a very detailed scientific review of the vaccines with the latest, most current information, so that when the societies make their recommendations, they're basing it on the most current science. And that's what we're doing now. That'll help everyone, because again, all of the different uses of these vaccines from all these different professional societies is obviously critical to overall better health. And by having this information, we're hopeful that payers will in fact agree that they can't support the ACIP recommendations that may be compromised, but they can accept a body of science that has very openly and with full disclosure demonstrated just how important these vaccines can be.
What does all this disruption do in areas where uptake of vaccines is already low? I mean, is confidence in vaccines further eroded?
That's the real problem we have today, is confidence in vaccines, because people are getting so many different messages about vaccines depending on who it is that's delivering them. As I mentioned earlier, over 50 mistakes or misinformation were shared at the ACIP meeting, which, I mean, you go there to find the truth, to find the scientific message that is factually based. If you have this kind of situation where you can't count on it, you don't know it, but the public hears that this came from the Centers for Disease Control and Prevention, you're led to believe, oh, this must be true. And so this creates a really significant challenge for us, is to get the kind of information to the public that they can trust and that they can understand how we came about getting this information.
Because right now measles is a real and growing threat. How much does that concern you?
Oh, measles concerns me a great deal. I mean, when you look at what's happened in this country, where we're talking about roughly 1,200 reported cases, we believe there's more than that. But look at Canada, where now they have over 3,800 reported cases of measles. And remember, Canada only has 40 million people compared to our 330 million people. And so you can see that that's just on our doorstep. And they have the same problems with vaccine hesitancy and people not willing to get vaccinated. And so over time, I'm afraid that it's going to take us a really, really unfortunate course of severe illness, hospitalizations, and deaths to help people understand just how powerful these vaccines have been.
Dr. Michael Osterholm, thanks very much.
Thank you.
The federal spending and tax bills propose deep spending cuts to health care, greatly impacting Wisconsin's tribal communities. Here and Now reporter Erica Acey spoke with Shannon Holsey, president of the Stockbridge-Munsee Band of Mohican Indians, about how these proposed cuts could impact tribal clinics in the state. She's here to describe that impact. Erica?
Fred? Tribal clinics like Stockbridge-Munsee Health and Wellness Center provide medical services to tribal members and community members, but proposed spending cuts to Indian health services, Medicare, and Medicaid would cut across all Wisconsin tribes. This report is in collaboration with ICT, formerly Indian Country Today.
It's not just a budget, it's a trust and treaty responsibility that, the United States has entered into with tribal nations for what was taken and what was supposed to be returned in the loss of our land.
Shannon Holsey, president of the Stockbridge-Munsee Band of Mohican Indians, says the tribe's Health and Wellness Center is partly funded by the Indian Health Service, or IHS, a federal agency that provides tribal medical services across the country, including for Wisconsin's 11 federally recognized tribes.
So that is the unique relationship that exists and the agreements that were entered into by the United States and tribal nations.
While the proposed $8 billion budget for IHS is an increase, Holsey says the package lacks advanced appropriations that are needed for funding predictability.
What one of the existential threats of this big, beautiful bill is that they're going to strip the advanced appropriations and we're going back into a dysfunctional cycle.
Funding the tribe's health center is complex.
It costs our nation about $16 million to operate it annually. Of that, it's multifaceted in the resources that come. It's a mix of both private insurance and Medicare.
27% of the tribal clinic's funding comes from Medicare and Medicaid. According to the Congressional Budget Office, the proposed bill would reduce federal Medicaid by $793 billion.
We have a responsibility to our citizens as a sovereign nation, so it's going to be up to our tribal government to come up with that offset to meet the basic needs and demands.
What are some of the health concerns that tribal members are facing in the community?
What we're seeing in our community is disproportionate rates of people being diagnosed with heart disease, diabetes, and cancer, alarming rates of cancer. And as you can imagine, that will tax your healthcare systems.
The bill also proposes adding job requirements to Medicaid. Holsey says she's concerned that Wisconsin's rural tribal communities could disproportionately lose coverage because of additional hurdles to accessing health care.
There hasn't been a well thought out plan in terms of how that is accessed. But really what we're talking about is a human rights issue.
Holsey says there's room for compromise in the proposed federal spending and tax bill. But for her, access to health care for Wisconsin's 43,000 tribal population is non-negotiable.
We also have a responsibility as tribal nations to make sure the federal government upholds our trust and treaty responsibility and robustly engage and remind the United States government and others that as sovereign nations, they have a responsibility to tribal nations.
Even as the wrangling over the federal spending tax bill continues, one provision of the Medicaid overhaul would eliminate the opioid abatement program. That's a prevention program addressing the opioid epidemic affecting Native communities across the state. Fred?
Thank you, Erica. In related news, it began as an emergency response to the pandemic, but the Tribal Elder Food Box program has grown into a vital source of nourishment and cultural pride for Wisconsin's Native American elders. Now, with federal funds running out, the program's future and the health of those who depend on it faces new uncertainty. Here and Now reporter Aditi Debnath has the story.
Whenever you eat indigenous foods that were culturally appropriate to who you are, it actually speaks to your DNA. It actually speaks to who you are as an individual.
The Tribal Elder Food Box program launched during the COVID-19 pandemic to address food insecurity among Native American elders in Wisconsin's tribes.
Our very first distribution here, I don't know if it was 2021, but we distributed 400 boxes in I think an hour and a half. And so from there, the program just keeps growing and growing.
The program provides elders healthy, culturally relevant food from producers that use sustainable practices.
We had 20-something indigenous producers. Now we're up to like 40 or 50 indigenous producers.
Today, dozens of indigenous farmers, food makers, and processors supply food for the boxes, creating new markets for native farmers. Initially serving just 3 tribal communities, the program quickly expanded to reach every indigenous tribe in Wisconsin.
We're going all the way from the top of Wisconsin, Bayfield, all the way down to Milwaukee, and down to Madison, to Ho-Chunk.
Tara Roberts Turner is the manager of the Wisconsin Food Hub Cooperative, a statewide organization that helps local farmers sell and distribute their product.
It's definitely more difficult.
This year, the loss of federal funding for the U.S. Department of Agriculture's Local Food Purchase Assistance, or LFPA, sent shockwaves throughout the country, disrupting vast networks of producers, distributors, and recipients. The Food Hub, which provided distribution for many food bank programs under LFPA, found its infrastructure caving in.
We had a lot of backhauls from the tribal elder runs, so we would go all the way up to Bayfield, and then we would pick product up all the way back. Now we're left bringing an empty truck all the way back.
The funding cuts have forced logistical changes, increased costs, and left trucks empty on return trips, straining the entire operation. The challenges extend beyond food delivery, impacting local economies and farmers, including indigenous farmers.
It's been a great partnership to really grow together over the past couple of years.
Isaiah Scannendor oversees a 50-cow herd on his beef farm in Seymour, Wisconsin. He joined the LFPA program to supply beef and chicken directly to tribal elders.
One thing that was unique with that program was you got to pick where your product would go to the end user. And so I was able to have all of our beef and chickens that was purchased through that program and under contract get sent to the Elder Box program.
Scannendor, a member of the Oneida Nation, uses regenerative farming techniques like rotational grazing, which mimics natural grazing practices and promotes healthier soils and livestock. He says the program's focus on fresh, sustainable food is a major shift from the past, when federally funded food boxes known as tribal commodities were often filled with processed items like canned meats and powdered milk, which were high in preservatives. For many Native families, these foods were a lifeline, but they also contributed to health problems that still affect Native communities today.
When I was a kid with my grandma, I remember going and picking up the tribal commodities, which is right down the road here, and you'd get the government commodities, which would be the flour and processed cheese and processed foods, and it's led to a lot of the epidemics we have, throughout Indian country. And to come full circle now and be able to provide high quality protein and sustainable food source to our elders, we take a lot of, it really, makes you pretty proud.
Indigenous people are 1.5 times more likely to develop diabetes and up to 3 times more likely to experience heart failure. For elders like Kathy Hughes, the food boxes make a difference.
And I find when I don't have stuff like that in my refrigerator, then I'm doing the fast food. I'm doing a lot of sandwiches and, cold cuts, that kind of stuff. Not really healthy for you. Versus the boxes, I'm cooking and I'm getting healthy stuff when I cook.
Beyond physical health, the program helps foster connection between Indigenous people and their culture. Marlon Scannendor is an Oneida councilman who brought the food box program to his tribe.
I ran a food pantry for 6 years, and in the beginning, a majority of the people that we seen was just single elders, 65 plus, living off Social Security. They don't have enough to pay their bills. And so if some of the items that you would get in here are going to be expensive items, the things that they wouldn't be able to afford or they would just walk by in the grocery store. So us to provide this nutritious, good, wholesome food to them, I think is vital for their longevity in life and being a part of this community.
For the past 2 years, the Tribal Elder Food Box program has received funding from the state's biennial budget. For 2026, Governor Evers has asked the state legislature to approve $2 million for the program. The end of the federal LFPA program leaves a $1.5 million gap in the program's budget come 2026.
We've looked at incorporation as a nonprofit and starting to look for some of the philanthropic funding out there. There are many who want to see us succeed. And thank God they're there.
Gary Besaw, one of the program's founders, says the funding challenges are daunting, but the farmers say they need help.
They're coming forward and saying, we were depending on that. Is there room? Do you need product? If you can, that's going to help keep us going. This will keep us from going bankrupt.
The fate of the Tribal Elder Food Box program will signal not just the state's commitment to its native communities, but also its vision for local food systems, rural economies, and the dignity of its elders.
I know my doctor is probably pleased.
I always tell people, we're not smart. The old people were smart. We just parrot them. And people might think, these guys know what they're doing. That's because we listen. We listen to the old people.
Reporting from Oneida, I'm Aditi Debnath for Here and Now.
For more on this and other issues facing Wisconsin, visit our website at pbswisconsin.org and then click on the News tab. That's our program for tonight. We won't be here next Friday. Here and Now is preempted for some national holiday programming. I'm Frederica Freiberg. Have a good weekend and a great 4th of July.
Funding for Here and Now is provided by the Focus Fund for Journalism and Friends of PBS Wisconsin.